My name is Staff Sergeant Joseph Picheri. I got my EFMB in 2014 at Schofield Barracks, Hawaii.
My name is Sergeant First Class Avagaro. I received EFMB in Korea in 2015.
My name is Staff Sergeant Belasama, and I earned my EFMB in 2015 at Joint Base Lewis McChord.
All right, our task today is going to be to extricate casualties from a vehicle. Your conditions: given a conscious casualty with a suspected neck or spinal injury that is in the driver's seat of a vehicle, and another casualty who does not have a suspected neck or spinal injury in the passenger seat of a vehicle after a motor vehicle accident or explosion. The tactical situation warrants extrication with a short spine board, Kendrick extrication device, or Oregon spine splint, which is available. A long spine board is also available. A non-candidate soldier is available to assist. The standards: secure and extricate casualties from the vehicle within 25 minutes without causing further injury to the casualty. Note, the EFMB host unit will have the candidate perform this task on 2 to 4 casualties depending on the lane concept. At least one casualty will be extricated from a vehicle using a KED, OSS-2, or short spine board. However, they will all be tested at the same testing lane. Failure of a candidate to perform any portion of the task to standard on any of the casualties will result in a no-go. Your time begins when the candidate begins attempting communication with the personnel in the vehicle. Step 1. Consider extraction priority. Is the vehicle on fire, under direct fire from the enemy? And determine the mechanism of injury. Step 2. Gain access to the casualties. Step 3. Identify all injuries and either treat or delay treatment until after extrication based on the severity of the injuries and the tactical situation. Step 4. Stabilize the cervical spine by directing a non-candidate soldier to immobilize the casualty's head and neck using manual stabilization and apply a cervical collar. Then select, measure, and apply an effective, properly fitting cervical collar, if available, or improvise one. Step 5. Apply a spinal stabilization device using one of the following: KED, short spine board, or OSS-2. We will be utilizing the OSS-2. Securing the casualty to an OSS-2. Move the casualty forward to allow 2 to 3 inches of space between the casualty's back and the seat, maintaining the entire spine in alignment. Remove the OSS from its case and unfold the 2 center sections. Place the OSS behind the casualty in the space created between the casualty's back and the seat. Release the groin and torso straps. The torso strap should rest just under the armpits of the casualty. Pass the shoulder straps across the casualty's chest and attach them to the corresponding strap at each of the casualty's armpits. The buckle of each strap should be positioned on the anterior portion of the chest and be generally mid-clavicular. Attach the second and third set of straps to their corresponding color. Ensure that each strap is not tugged, but gently pulled to assure inline stabilization. Do not make the straps so tight as to make it difficult for the casualty to breathe. Bring the groin straps under each leg by using a sawing motion and attach to the corresponding strap at each thigh. Pat each strap in the groin area before connecting them. Reassess all of the straps to ensure that none are too loose. Place the provided padding between the casualty's head and the device as needed. This will help to ensure that the head and neck will maintain a neutral position. Do not place the padding behind the casualty's neck. The candidate will now take over manual cervical spine stabilization, and the non-candidate soldier will position the head flaps along the sides of the casualty's head. The candidate will direct the non-candidate soldier to regain control of the cervical spine stabilization, and the candidate will position the forehead restraint strap with the padding toward the casualty. Move any hair from the casualty's forehead and place the forehead restraint strap on the casualty with the lower edge covering the casualty's eyebrows and attach to the Velcro on the head flaps of the device. Place the collar strap on the rigid chin rest of the cervical collar. Pull the ends of the strap upward at an angle and attach to the Velcro on the device. Step number 6. Remove casualties from a vehicle with the assistance of the non-candidate soldier using the OSS-2. With the assistance of the non-candidate soldier, grasp the extrication device and the casualty's legs. While stabilizing the casualty's head and neck as much as possible, lift the casualty free of the vehicle and move them to a safe place on the ground. Reassess the straps on the spinal stabilization device after removing the casualty from the vehicle. Step number 7. Secure the casualty with a suspected spinal injury to a long spine board. Note, the pelvic straps of a casualty who is secured in an OSS must be released after being placed on a long spine board. The time ends when the casualty is secured to the long spine board. Complete all requirements within 25 minutes without causing further injury to the casualty.